So thank you very much for inviting me to come and talk to you about our journey over the last 7 years. My name is Dr. Kingston. I'm a GP in rural England, and my colleague Jenny Hartnoll and I will be talking about the work that we've been doing here in Frome. We were very fortunate to be given the opportunity of a fresh start in 2013, and our journey began with moving into a brand new health centre with an integrated team located with us. We really wanted to improve the healthcare of the population as a whole in our town. We were aware very much of the importance of social relationships and of the devastating impact when networks break down, both on mortality and morbidity. And we wanted to bring this knowledge into day-to-day practice within our general practice setting. We wanted a whole system approach based on kindness, compassion and trust that would break out of silo working and integrate the care that was required around an individual, so that they and their carers felt supported and had the sort of care that we would want to be able to give to our own family and friends. This was important for our patient care and also for the well-being of staff who really wanted to be able to give world-class care to those that they were dealing with. And we set up an enhanced model of care which had a number of elements. So we tried to improve the medical care by setting up a care coordination hub with in-reach nursing going into our hospitals, with medical and nursing care and some admin support. And alongside this, we reached out to the other organisations looking after our patients. So the other agencies that would be able to offer support for particular problems, our district nursing, the support that already existed, but in a fragmented way, to support people coming home with rehabilitation, and financial, social and mental health advice. And we were fortunate in being able to set up our Health Connection service with community development embedded within the GP practices, and to be able to map out the many groups and services that were available and ensure that the whole community was aware of what was available to offer.
I'm Jenny, I'm the Health Connections service lead, and what the service Health Connections Mendip does is we knew there was a huge amount of support in the community, but GPs didn't necessarily know where it was and when it was. So we mapped everything that was out in our town, in our community, all the singing groups, all the exercise groups, the carer support groups, the young people's mental health groups, and put that all on a website. So that website directory was available to all. So anyone, whether it was somebody working in the GP practice or anyone in the community, could have that information at their fingertips. So that's social prescribing. So anyone who's coming to a GP practice who might need support with something that's perhaps not medical has that information that can be pulled down from that website. So the GP can almost give a prescription for a running group, for a walking group, for the carers group. So they're giving that information to the patient, which helps them work in a more holistic way when working with people. There is a huge amount of support out there, so we try and communicate that in a number of ways, so it's not just reliant on the website. So we do that via social media, via radio, via newspaper, and it's not about our service, it's about all the support out there in the community. When we find in the community that there is a group or service that's missing, we help the community to build that group. So we will work alongside community members to start up, for example, a dementia support group, a stroke support group, whatever the community wants to get involved in and where they see and perceive a gap, we can help them. We also run talking cafes across the town. And these are places where people who might be feeling a bit lonely or isolated or just connect and make friends can meet up. And they can also be signposted to support. So it's a physical place instead of relying on a directory on a website. It's a physical place where people can come and find out about what's available in the community. We also have one-to-one support from our health connectors. And our health connectors are people who will support people with things that are going on in their lives that they can't necessarily support, sort out themselves, and they just want someone to walk alongside them to help them set goals. And we do motivational interviewing with those people and create something called My Life Plan. We also realise that it's not just enough to have a website and to have a physical place to find out this information and to find out this information from GPs, but we actually think that a good place to find out information is from your friends, family and neighbours. So we set up the Community Connector Scheme. So we've trained over 1,400 community connectors who have on average 20 conversations a year. That's 28,000 conversations a year, signposting conversations that they will have with friends, family and neighbours. So it's making all that information about what's available in the community come alive via human beings, via those friends, family and neighbours.
So we set out to improve the healthcare that we were offering, and were very surprised when data showed that actually doing the right thing was leading to cost savings. And we were fortunate in having a journal published in the Royal College of General Practitioners literature to verify this. And that led to an article in a leading newspaper in England about our work. And with that, a flood of interest came forth because we were making a difference, and that was making a difference to people's lives, which was the thing that was important to us, but also seeming to be making savings for the system as a whole. And we've had a wealth of inquiries from this country and from many other countries as well, from all areas across the world. And this was the data that we presented, showing that doing what matters most and focusing really on what an individual and their family needed was efficient as well as highly effective.
So from these visits and inquiries that we've had from this country and abroad, it's amazing to see those sparks that have been lit up. People really interested in our work, but also us being really interested in other people's work. And the amount of shared learning that's happened from that is wonderful. And it's almost like what happens in communities, that you find those people who have got that energy and that passion, you link them all up. You have that trust that things will turn out okay, and that working in this way based on trust, kindness, compassion and building relationships will end up with people. This image here is supposed to be moving, but it's actually that sort of those people getting together and the power of doing things together and the power of communities working together and individuals working together. And we've seen that, the power of us working with different areas of this country and abroad, of the shared learning and the relationships that are built through that shared learning. These are just a few of the organisations that we've helped. When I say helped, we've shared our work with, but we've learnt from them as well. So the work we've spoken about before, Dr. Kingston and I, has been funded by the NHS. However, sharing our work does take time, and we have lots more we want to do. We don't have funding for this yet, so here are our next steps. We are planning to build on our Community Connector programme, those 1,400 people who are trained to signpost friends, family and neighbours to support. We've realised during COVID that there are lots of people who don't have access to the internet and who don't know how to get onto Zoom or Microsoft Teams or how to find out information from the NHS. So we're going to be training up digital connectors. We've also realised that people aren't getting their hearing aids cleaned and retubed, but actually there are fantastic videos there online. So we're going to get hearing support connectors. We're working with an arts organisation to have creative connectors. We've also seen that planning ahead for when we become less well, we don't talk in communities about that. And actually, how about if we can get communities all talking and all planning and all feeling more confident and relaxed about planning ahead for when we become less well. We also applied as a town for some funding to be a greener town, and Green Connectors was part of that funding. We didn't get it, but that's still on our wish list for the future. So people who will signpost friends, family and neighbours to all things green, whether it's to information or to things out in the community. We also have ideas like walking taxis. Why can't people call up a taxi company, a volunteer driver scheme, and actually ask for someone to walk with them rather than get in their car and drive? We also had an idea we saw during COVID that we had lots of issues around mental health. And so we found a booklet and we created this booklet, and we had 47,000 of those booklets delivered by volunteers in the community to their friends, family and neighbours. So once again, building on this huge power of the networks in communities and how we can all support each other as communities. So this was a bit about our green connector, that we see our work as a whole population. So it's not just about let's build a flower bed and with herbs in it. It's about how do we have the group education around that? How do we work with local green spaces? This was a nursery where they sell plants, and we had an agreement with them that they would do it pay it forward. Somebody would buy a plant and that plant would then be taken by a volunteer to someone who's housebound. And they would then be part of this bigger network by actually working with a volunteer and having those plants in their homes. So this is about that whole population approach to the way we see things and the way we work here in Frome. We're also working with a university in Canada about getting this online tool, which is about how we talk about planning ahead. So how we talk about, do I have a will? Would I like to be cremated, or would I like to be buried? And actually having these kind of online tools helps us have those conversations in the community. And this, we were inspired by actually an organisation in Australia that has something similar. So that's going back to that shared learning. So we've got some really, really exciting ideas. We've done some fantastic things, but we're really looking for partners who want to help us with our onward journey of innovation and the sharing of our work. If anyone's interested in getting involved and finding out more, that'd be fantastic. Do get in touch. That's goodbye from me.
And goodbye from me. Thank you very much.